Hello, everyone, and welcome to the weekly Multicultural Media Online Conference. I'm your moderator, Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service. And on behalf of the Ministry of Health and Multicultural New South Wales in our service, thank you very much for joining us again today. Our New South Wales Health Senior Medical Advisor, Dr. Jan, will be here to provide COVID-19 updates and answer your questions for your community. Dr. Jan and I are not joining from the studio this afternoon, as you can see, as some of our colleagues have been exposed to COVID-19, and we're making sure that we are keeping everyone safe. So we're joining online. We'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. I'm joining from the land of the Darug people, and I would like to acknowledge the traditional custodians of this land. We pay our respects to elders past and present and emerging, and extend the respect to Aboriginal elders and colleagues. We also would like to acknowledge the elders from all multicultural groups represented on this online briefing. Please do add your name to the chat. Let us know where you're joining us from today. We encourage you to please ask your questions and comments on the chat, and we'll do our best to answer them today. Well, Dr. Jan will. We want to, of course, have a lively discussion, so please share your thoughts with us, ask all the questions that you have, or from what you're hearing from the community. Throughout the session, my colleagues from the Multicultural Health Communication Service and Multicultural New South Wales would be adding links onto the chat for any new COVID-19 resources in available multiple languages from the New South Wales Health and New South Wales Government websites. We also encourage you to please share any links or activities or your articles from your multicultural media outlets that you would like to share with everyone attending this session today. It's now my pleasure to hand over to Dr. Jan for an update. Dr. Jan, how are you today?
Well, thank you, Jess, and good afternoon, everyone. So today we're reporting just over 24,000 cases in the period to 4 p.m. yesterday afternoon. That included 13,957 people who tested positive and registered their results from their rapid antigen tests, and 10,194 PCR tests from just over 58,000 PCR tests in New South Wales. We currently have 1,444 people admitted to our hospitals, including 51 people in intensive care, 18 of whom required ventilators. Sadly, we are reporting 15 deaths from people with COVID-19, 9 men and 6 women, 2 people in their 60s, 5 in their 70s, 3 in their 80s, and 5 in their 90s. It's really important that we do get our booster doses, and that as people become eligible for their winter booster, those who are over the age of 65, those who are profoundly immunosuppressed, or those who live in a residential disability facility, that we do take up that opportunity for vaccination. We have had just over 64.5% of the eligible population take up their booster doses. We still only have 49.6% of children aged 5 to 11 who have taken up their vaccination. So it's really important that we do get our children vaccinated, because there can be serious consequences from COVID illness in that age group. We've had 79.5% of young people aged 12 to 15 who've completed their vaccination course. And again, really important as we move into winter, we move into times of family celebrations and get-togethers, that we do encourage our young people to have their COVID-19 vaccination to help keep themselves and their families safe. Thanks, Jess.
Thank you so much, Dr. Jan. We'll go to the questions. Again, a reminder to everyone, please add your questions onto the chat. A question from Shell Wang, editor from Yiji, Chinese media. We have learned that many Chinese people report that the cost of purchasing rat is very high. Since there are always confirmed students in the children's classes, many families need to take self-testing frequently. Has the government considered any improvements to this situation?
So there's still being kits distributed through New South Wales schools. So if you are in that situation, do reach out to your child's school to see if there are any tests available. There are still tests that are subsidised available for people who are on low incomes. They're able to get them from chemists. And also generally the cost of those tests are coming down. So do shop around. I think they've come down from those terrible prices we were seeing around Christmas at about $20 per kit, down to about $7 per kit online. So whilst it can be an expense, compared to losing time off work or having a family member unwell and having to take time to care for them. They can help prevent that from happening. So please do look at all those different channels. And again, I do know that Multicultural New South Wales has been working with the Ethnic Communities Council and several groups to make sure that there are RAT tests available for people. So please do look into your community to see if there are any of those tests available from Multicultural New South Wales, but also where there is a real need, particularly if somebody has symptoms or if somebody is unwell or somebody has had a high level exposure, so they're a household-like contact, please remember that those PCR tests are still available at the moment and they are free of charge.
Thank you so much, Dr. Jan, and thank you so much, Shell, for that question. Another question here, Jan, is what's available with regards to medicine for COVID-19, for treatment, and who and where can people access these medicine?
So one of the most exciting developments in the last few weeks has been the availability of antiviral medications for COVID-19. There's two main drugs. One is molnupiravir, and the other one is a combination of an antiviral agent and an agent that slows down that antiviral's metabolism, and that is trademarked Paxlovid. Now, both of those medicines are useful for people who have had mild symptoms and who are within 5 days of that mild symptom onset and who are at risk of progressing to severe disease. So the people who are most likely to progress to severe disease are those who are unvaccinated, people over the age of 65, people from certain communities who are over the age of 35 where we know that there have been poor outcomes, and that's particularly the Pacifica community and people who are of Aboriginal and Torres Strait Islander background, people who have other significant chronic diseases, particularly where they have a combination of them, such as type 2 diabetes, with some renal impairment. So really important that people are aware that those medications are available. And it's really important that people know how to get them. And so if you look at our testing positive to COVID-19 fact sheet, that's actually sitting up in the chat at the moment, you'll be able to see that there is a number for people to call and they can ring if they are in those higher risk groups, and we'll help them connect to care either through their own GP or if their GP is not available or if they do not have a GP through New South Wales Health. But if you are in a higher risk group, it's worthwhile having that conversation with your GP when you next drop by for your checkups to say, if I had COVID, would I be eligible for treatment? And would you be willing to prescribe that for me? So that before this even happens, you already have a pathway to care.
Thank you, Dr. Jan. And I guess a question of if you don't have access or aren't able to go to this, what can you do? You can use virtual care and telehealth, isn't it?
Correct. So the Commonwealth Government has made an arrangement to make sure that telehealth rebates for GPs are in and are permanent. So for people with a Medicare card, they're able to access their GP through telehealth. It may or may not be free. Some GPs bog bills, some GPs don't, but you should be able to get access to both professional advice for your COVID as well as care from your GP.
Thanks so much, Dr. Jan. Another question here, and I guess that's with COVID-19 everywhere. Why do people need to get vaccinated? And it's a question that's been asked multiple times.
So something that we're still learning about COVID, and I think I'm the first one to say that there are things that we thought were true that we are now learning are not true with COVID. One of the things that we're learning about COVID is how long our immunity lasts, either through vaccination or by catching the infection. What we found out is that people who had the Delta strain of the virus last year, after about 3 to 4 months, that protection has waned and it gives you very little protection against the Omicron variant. Similarly, particularly for older people or people who are immunosuppressed, their ability to maintain a higher level of immunity after vaccination is lower, which is why we're recommending the winter booster. And even for people who are not at particularly high risk, but for most of us who had our 2 doses last year, it's now time to get that booster. And it's really important to get that boost because it does just give our immune system a reminder. This is what COVID looks like, and this is how we fight it. And our immune system can respond better than if we actually come into contact with COVID because we've given it a reminder. It's a bit like, off-season training for our immune system. We'd already trained it once. We got really good at fighting COVID. And then when we don't train for a while, our immune system starts to forget. That vaccine is a reminder, and it's a much safer reminder than actually coming into contact with COVID itself.
Well, Dr. Jan, following what you've just said, there are questions from people asking why they should get the flu vaccination when the flu, for many, is considered as less dangerous virus than the COVID. Many people who have had COVID had mild symptoms, so they're asking why even have that vaccine or booster?
Look, unfortunately, we know that flu for many people is a very mild illness, but for some people, even some young, fit and healthy people, it can be a very severe illness. We haven't had flu for a couple of years in Australia. Those border closures that broke so many of our hearts kept the flu out for 2 years. The borders open, flu can come back and flu will come back. So it's really important that we do get vaccinated against flu. The flu vaccines are becoming available in April, and it's really important, particularly, again, people who've got chronic illness for whom the flu vaccine is free. Now, unlike COVID, where kids under the age of 5 can have a poor outcome but are less likely, kids under the age of 5 do often have poor outcomes from flu infection. So really important to get young kids vaccinated. It's free in New South Wales for them. And for older people, there's a particular type of flu vaccine that helps encourage their immune system because, as I say, as we get older, our immune system doesn't work quite so well. And so there's a particular type of vaccine for people over the age of 65 for flu. So really important, a COVID vaccine won't protect you against flu, and a flu vaccine will not protect you against COVID. They're two very different viruses, and our immune system needs to recognize those two very different viruses. So really important coming into this winter, we need to be up to date with our COVID vaccination. We need to have our flu booster for this year so that we've got the best possible protection, because the better protected we keep our community, the more likely we are to be able to keep our hospitals and other medical services going to try and catch up all those people who may have missed out on, elective surgery and everything else. We want people to be able to keep getting care in a timely fashion. One of the best ways is by keeping people out of hospital with flu and COVID.
Well, Dr. Jan, you said that it's important to have both vaccines for those who are eligible, of course. But the question is that people are asking, we've received it, is why is the flu vaccine free? The COVID-19 vaccine is free and the flu vaccine isn't.
So for the vast majority of people, we have seen people of all ages and all backgrounds in hospital with COVID. And so to protect the hospital system, we do need to get people of all ages vaccinated against COVID because it's got quite a high admission rate. For young, fit and healthy people, they may not commonly get admitted to hospital because of flu. They're more likely to miss work or to take flu to people they care about, such as older parents, or to give it to young kids. So with flu, there's less of a reason to subsidise that flu vaccination for young, fit and healthy people. Having said that, it's $10 to $15 from the chemist. So whilst I acknowledge that for some people that's a good sum of money, for other people that's a couple of cups of coffee not taken. So it's a really good way of making sure that you can stay at work, stay well this winter by getting protection against flu.
Thank you, Dr. Jan. There's a question here that's coming up. What are the long-term effects of COVID, and what can people who have had COVID maintain? How can they maintain their health and well-being?
So one of the things we're learning about is this long COVID syndrome that people speak about, where people have fatigue, people can have problems with thinking, pulling thoughts together, and people can have muscle aches and pains. And that can last for a number of weeks to months. We're still learning about it and learning about what it actually means and what the best treatments are. But that's certainly something that, particularly in the UK, they're doing a lot of work on. So we're taking our steers from the UK. One of the really interesting things is that vaccination helps prevent long COVID. And even in people who've got long COVID, if they become vaccinated, it can actually sometimes help resolve their symptoms. So that's a really interesting outcome. It's not completely true for everybody, but it's certainly something that has been reported in the literature. The other things, of course, with COVID are the fact that if you've had a hospital admission and you've had lung damage from the COVID, or you've had kidney damage from having had COVID, they can take quite some time to resolve, or you may have scars from it for quite some time afterwards. So it's really important that we try to avoid people getting so sick that they need hospital care. And it's really important that we support people after they've had COVID. And the best place to start that journey is by talking to your general practitioner about what's going on with you, and making sure that they can do some tests to check to see whether you've got something else or whether it's COVID. Because we have to remember that with so many people having had COVID, in a normal year, we'd have people being diagnosed with thyroid dysfunction, we'd have people being diagnosed with other autoimmune diseases, and we need to make sure that we don't just write off any poor health after we've had COVID to COVID. We do need to make sure that we do connect with our GP and have a good thorough check over to make sure that if there's anything correctable, we correct that before we blame it on COVID.
So, Dr. Jan, you talked about long COVID and described what it is, but when people do have long COVID, what is the situation with PCR and testing? Is it required if they still have symptoms?
So one of the things that our PCR tests are really good at is telling us that we've got a high viral load, and it helps us for our initial diagnosis. What PCR is not so good at is helping us work out whether somebody's still infectious or got virus floating around. And that's simply because PCR can't tell the difference between dead virus and live virus. PCR will amplify the genetic material, whether it's from a dead virus or from a live virus. And so you can actually be persistently PCR positive for a number of weeks after you've actually cleared the infection, and even if you have no symptoms whatsoever. So it's really important that you don't rely on a PCR test in that 12 weeks after you've had COVID, and that if you do get symptomatic with cold and flu symptoms, that you do talk to your GP. If you have every single member of your family sick with COVID that's been diagnosed with COVID and you had recovered and you've got symptoms again, talk to your GP before you go and get another test, just so that somebody can help you interpret those results when they come through.
Thank you, Dr. Jan. And you mentioned about visiting GPs. A question here says that they've noticed that during this COVID time, number of GPs have been reduced. Any comment on this?
One of the things that we know is that a lot of people have become disconnected from care during COVID, and it's something that people really need to start building back, that connection to their GP, so that conditions like diabetes, conditions like anemia, even getting ready to have a baby and getting checked before you decide to go on that journey to have a baby, all of those things are things that your GP can help you with. Also, we know that some people are struggling with mental health issues after COVID. They could be anxious as we see everything opening back up and they've got to go back to work and they're in a workplace, or they could just be generally anxious because, or they could just be really sad because a lot of people that they know and they've been around have not been there, and they could be, moving from being sad into having depression. So it's really important that we do start reconnecting with our healthcare practitioners so that we can get support, so that we can get tailored support. And particularly people, I know that, for example, a whole lot of people who would normally have had blood tests, they haven't been being done. So it's really important that, if you're on a medication that usually you have a blood test to monitor, that we get people back into the habit of engaging with those blood tests, engaging with their healthcare professionals, so that now that people are moving from telehealth back to face-to-face care, that we do have people not having bad outcomes from those chronic diseases that so many people have to manage.
Thank you, Dr. Jan. And if you've just recovered from COVID, when can you go back to visit your GP or your health provider?
So most GPs would ask that you're at least 10 days after your diagnosis before you go back to care. And that's our advice from New South Wales Health, that you're 10 days from your diagnosis and that you don't have any persistent symptoms. If you've got persistent symptoms like a cough or you're still not quite right, rather than going in to see your GP in person, do make a telehealth appointment instead.
Thank you, Dr. Jan. A question here from the community about do they need to stay, if you've had COVID, do they still need to wear a mask on public transportation? Some people who've had COVID are feeling quite invincible and not taking COVID safe measures. What's your advice?
Look, I think apart from anything else, wearing a mask will help protect you if you are the one unlucky person who manages to get COVID twice, but it'll also help protect you against flu. It'll help protect you against RSV. So while the rules are in place that we should all be wearing masks on public transport, I think it's a very good reason to be wearing a mask on public transport, just simply because there's lots of stuff going around. A bit like when Omicron came. No one knew that Omicron was here until it was really here and starting to spread. If you got over Delta and had decided, I don't need to wear a mask because I've had Delta and I was fine, you could have been in for a very rude shock if a person with you sat next to you with Omicron and snuffled all over you. So I think wearing a mask is just one of the ways that we show each other that we respect each other and that we're part of a community who cares, and particularly on public transport where, you know, a lot of people don't have any other options how they get to work. And so we show that we respect each other and we care for each other by wearing a mask.
Thank you, Dr. Jan. That's really important. I think that's a really good message to show respect by wearing a mask and not spreading the germs, I guess. And that's why we're not, we're joining online right now. A question about why COVID cases in other countries are going down, but the cases in Sydney and Australia are going up.
So I think one of the things is that each country is in a different place with their epidemic and their vaccination rates. In Sydney, we had that big outbreak over Christmas, followed on from that Delta outbreak in August, September last year. So we're now at a point where a lot of people either got vaccinated during that Delta outbreak or who got Delta themselves. Their immunity to COVID is starting to wane. So it's very definitely a time to get that booster dose in to try and prevent the cases from increasing more. I think one of the pleasing things about this current particular hump in our COVID numbers is we haven't seen the hospital and ICU numbers go through the roof like we saw with the first wave of Omicron. That doesn't mean that it's less severe. It just means we've got fewer people who are susceptible at the moment. But it is really important to understand that we do have unvaccinated, young, fit, healthy people who are still passing from COVID, not people with major pre-existing conditions, people who have been at work, got sick one day, and then not woken up 2 days later. So it is still really important that people understand that BA2, even though people say it's mild, it's really not mild if you're not vaccinated against COVID. It's still a very dangerous virus.
With BA2 around, Omicron, Delta, are there chances of other variants coming up?
Yes, so the World Health Organization last week gave some really interesting information to sort of say, look, we can see it going three ways. The most likely is that we will see a new variant from time to time that vaccination and prior infection will give us some protection from, but we may need to have a booster tailored to that new variant. The second idea is that we could have a really nice scenario where we have a highly transmissible variant that makes very few people very sick indeed. That would be fantastic. It hasn't happened yet. And then the third and probably the most troubling one is that instead of becoming a milder virus, we wind up with a highly transmissible virus that the vaccines do not give us good protection against. That's the least likely but the most severe outcome. So I think we'll still need to be vigilant for some time yet. We've been learning a lot about COVID, but it's still a relatively new virus for us. We're still only, 2 years, really 2.5 years into this journey. So we've still got quite a lot to learn and quite a long way to go. So important that we keep our minds open to new information.
And with that, Dr. Jan, April is a month of a lot of celebrations, and not just celebrations, cultural and religious events, but also celebrations from starting April, people celebrating other activities and in their lives. How important is it for people to get updated with their vaccination before attending or planning for events?
Look, I think a lot of us are going out to events where there's lots of other people for the first time in a long time. And being up to date with vaccination is a really good way of protecting yourself when you are going out to those events. The other thing I would really encourage people to do, though, is to maintain all the other COVID safe behaviours. So the first one is, of course, staying home if you're sick. It's really important that if you're not feeling great, that you are not out at a big family function, that you're not out at a big religious service, that you're not out socialising with friends, because no one needs a respiratory virus at the moment. If you're sick, stay home. The second message is, of course, if you are going out, particularly if you know that there's COVID floating around you and you're about to go to a place where you know there are older people, you may be visiting grandparents, you may have a multi-generational family gathering, please encourage people to do a rapid antigen test before they go. They're not perfect, but it will help protect people. Within my family, I know we avoided an outbreak at a family function by one of my nephews being tested by his parents just before they went together because there'd been some COVID around. And that meant that, there was a lot less heartache for our whole family just by that family doing that test. So please, if you are coming together particularly with older members of your family, or if you're in a community where there's a large number of people who've chosen not to be vaccinated, please do think about doing those rapid antigen tests before getting together. Keep the hand hygiene going. We had that run of gastro earlier in the year, and flu, colds, COVID can all come off our hands when we've got stuff on our hands and then we touch our face. It's much, much easier to give ourselves COVID, flu, RSV, whatever else is going around. So top up those bottles of sanitizer, hang them out and get ready to use them again. And of course, if you are going to be in a place where you're indoors and you can't physically distance and you're going to be seeing people for the first time in ages, please wear a mask. It really does help prevent transmission of COVID. It reduces it significantly. So please, that mask is really helpful, particularly if you're indoors. If you can meet outdoors, of course, that's great. But with Sydney's weather the way it is, I think trying to make sure that it's a well-ventilated indoor space is the best some of us can do at the moment.
And Dr. Jan, a lot of the people are concerned that they don't want to be missing out events. So how important is it for communities to be encouraging and being saying it's okay if you don't attend because you've got COVID or you're sick?
I think that's something that's really important, because for a lot of us, we feel that we either have a religious obligation to go to church, to go to the mosque, to go to temple on certain days, and that trumps any inconvenience or any sickness. I think this year we've got to stay vigilant. It's one of the first years where we've been able to gather over Easter, over Ramadan, without having significant restrictions on us in a couple of years. So I think it's really important that we understand that we are going to see people we haven't seen for ages. We're going to be together in ways we haven't been. So please stay COVID safe while we do it, and be accepting. One of the things that's really important is that, if someone can't come to the family dinner, if someone can't come to a religious service, making sure that they feel supported and safe in that choice, rather than, it's classic that you don't care about me if you didn't come, you care about me if you came. Well, no, I'm showing I care about you by staying home. And I think that's a different message to what most of us are used to.
Thank you so much, Dr. Jan. I think that's a good way to end the media forum today, just to encourage people to stay safe and to say that it's okay for them to not attend events, for keeping everyone safe. So thank you again, Dr. Jan, for being with us today. The Ministry of Health, Multicultural New South Wales, and the Multicultural Health Communication Service truly appreciate your support in delivering the important key COVID-19 messages through your broadcasts, publications, and channels for multicultural communities through New South Wales. Dr. Jan, any final notes?
Just to say thank you to everyone for your ongoing engagement with us. I think we've got some real challenges ahead of us, and trying to keep our communities protected is really, really important. We know in some of the LGAs that were hardest hit with COVID, both in the Delta wave and in earlier this year, the booster rates are quite low compared to other places. So please do what you can to encourage people to get those boosters, and for older people to get that extra winter booster in, because we really don't want to see them in our intensive care units and hospitals.
Thank you so much, Dr. Jan. And thank you so much for joining us and being with us all the time here on the weekly session. Please follow our social media channels to see the latest COVID-19 updates and resources in languages to share in your platforms and with your communities. And please save those links that you've seen on the chat. The recording of this briefing is available on the New South Wales Multicultural Health Communication Service website. Send us an email if you'd like to use this recording, and we'll send it straight to you as well on your email so that you can use it on your publications and newscasts. Take care and stay safe. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and our teams are so grateful for your ongoing support. Thank you.